Hello everyone. Today I will talk about the importance of oral health in pregnancy for both the mother and the baby on the way. The journey of motherhood does not kick off when you give birth to a baby, but instead it begins as soon as you realize that you are going to become a mother. In that moment of revelation, you are surrounded by so many thoughts, questions, confusions, and emotions that you forget that oral health is also an important aspect, especially in light of you taking up such a big responsibility. This video is meant for new parents embarking on the journey of parenthood or are at some later stage of this journey. I want to emphasize that your good oral health in pregnancy will not only benefit you but the baby growing inside you. For the comfortable arrival of your baby in this amazing world, the tips and suggestions given in my video will be quite useful. I will be covering the following topics. The 4 oral health risks in pregnancy, what should be your approach, prevention and management, nutrition and general tips. The 4 oral health risks are pregnancy gingivitis, periodontitis, dental caries, and dental erosion. Let's talk about these one by one. The first risk is pregnancy gingivitis. During pregnancy, the levels of estrogen and progesterone hormones shoot up, thus making you susceptible to increased gingival response to plaque in the form of inflamed and bleeding gums. This condition is called as pregnancy gingivitis. If it is not treated, sometimes it can progress to a more serious condition called as periodontitis. Here you can see on your left side a normal healthy tooth and on your right side a tooth affected with periodontitis. Periodontitis is the infection of supporting structures surrounding the teeth. In this condition, the alveolar bone that holds the teeth together begins to dissolve and as a result, teeth become loose. There is evidence in literature that periodontitis in pregnancy can lead to premature labor and low birth weight baby, and that baby becomes susceptible to acquire asthma, ear, and other infections later on in life. Dental caries, commonly known as tooth decay, is common in pregnancy due to increased acidity in mouth, sugary cravings, and limited attention to oral hygiene. If you have dental caries, it makes your baby also susceptible to it after birth. The fourth oral health risk is dental erosion. We all know that morning sickness doesn't spare anyone, especially during first trimester. The acid reflux due to morning sickness can lead to dental erosion. In this, the outermost layer of tooth, which is enamel, begins to dissolve. As a result, you experience sensitivity in teeth, and when that happens, you cannot enjoy your ice creams. We now know the 4 oral health risks. Now let's discuss what we can do to prevent and manage these risks. The first thing is obvious, but unfortunately not that obvious. You need to maintain good oral hygiene. Don't skip night brushing. Use a fluoride containing toothpaste and a soft bristle toothbrush. Flossing once a day is very important as it helps to remove interdental plaque where your toothbrush bristles cannot reach. Replace your toothbrush every 3 months. To remember this, you can change it at the start of each trimester. You may be at the stage of planning a baby. In that case, I recommend you to schedule a pre-pregnancy visit with your dentist so that your oral health is in check right from the start. These were some important preventive suggestions. Now let's talk about management of these risks. If you are affected by any of these oral health risks discussed, please see your dentist at the earliest. In case of gingivitis, you will need to get scaling done, which is professionally done teeth cleaning. Your dentist may also recommend you the use of mouthwash in this case. However, please don't use mouthwash indiscriminately without being advised. If you have got dental caries, which is tooth decay, you will need to get a tooth filling or a root canal treatment depending upon the severity. If the tooth cannot be salvaged at all, you may need to get the tooth extraction done. You will also face acid reflux phenomenon due to morning sickness in pregnancy. To help with this, I recommend rinsing your mouth with 1 teaspoonful of baking soda dissolved in a glass of water. It is safest to get your dental treatment done during second trimester of pregnancy, though emergency treatment can be availed anytime. After discussing these preventive and management tips, I will talk about some general do's and don'ts for diet and nutrition. Why our elders advise us to give extra attention to diet during pregnancy? That's because a mother and baby's diet are linked. The nutrients in maternal blood circulation are transmitted to fetus via placenta. This you can also appreciate in the picture. On your right side is a fetus which is connected to mother's placenta on left side via umbilical cord. So if you will eat healthy, the baby will also get healthy environment inside you to grow. Likewise, if you have any infection, that can also be transmitted to the baby. I vividly remember when I first saw my baby's image in the 11th week ultrasound scan. This moment is such an amazing one for a mother because that's when we realize that we are so inseparably connected to our baby. After that, in every subsequent scan, we are concerned about our baby's growth and organ development. Some people may be curious to know about the dental development of a baby and when it starts. I would like to share that the development of teeth starts in first trimester itself. In fact, it begins from 6th week of pregnancy onwards. For the optimal development of teeth, calcium and vitamin D are very important. So eat dairy products rich in these such as milk, cheese and yogurt. Banana is one superfood that you must include in your diet as it helps to replenish the potassium lost due to vomitings. Often in pregnancy, you don't eat when you are hungry, but you tend to overeat when you crave. Indulging in cravings is surely surreal, but please make sure that you don't go overboard since in between snacking on junk and sugary food is detrimental not just for your oral but overall health. Still, if one day you end up eating half a tub of ice cream before sleeping, as it often happens, don't be lazy. Ensure that you brush before going to bed. This advice may sound basic but is necessary because I know in pregnancy it can be really tiring to go from your bedroom to your washroom. Here, I request all the husbands to encourage your wife on the above said things and be their companion. Some people are fond of smoking and drinking. While smoking is hazardous at any stage of life, but in pregnancy, you need to absolutely avoid it, and same goes for drinking. If you are thinking there is a safe amount of alcohol that you can consume, I want to add that the only safe amount at this time is 0 ml. On these bittersweet notes, I will conclude my video and reinforce: stay positive, stay cheerful. Think about bright colors, color your space and choose room decor that evokes positivity. Think about the smile of your baby when you will soon hold him in your arms. I hope you found the suggestions and tips given in this video useful. Do share your feedback and questions in the comment section. In my next video, I will talk about oral health of baby right after birth till the first tooth erupts. Thank you and please subscribe my channel for more.